Sorry about those audio problems. We're going to take it from the top. So, hello, I'm Dr. Marie Bernard. I'm the Deputy Director of the National Institute on Aging at the National Institutes of Health, and I'm a geriatrician, which means I specialize in the care of older adults. I have been a regular exerciser since my 40s when I became really impressed with the data from the National Institutes of Health showing that exercise is really important to the aging process. If there was anything that was a fountain of youth, perhaps exercise was it. So, I'm going to talk with you a bit about the science that's behind that sense of mine. I'm going to talk to you about how much and what types of exercise are desirable. And then I'm going to demonstrate some exercises of the 4 domains that are important for older adults and talk a bit about modifications I've made personally given the COVID-19 pandemic. So, what does the science show? There's one study that very specifically looked at the role of exercise and other lifestyle modifications to decrease the likelihood of diabetes. In that study, they had young people, middle-aged individuals, and older adults, all who were at risk for developing diabetes. And they were given one of 3 approaches. One group was what's called the control group. They didn't really truly have an intervention. Then another group got medications. And then the third group got exercise and weight loss. And what was found was that for the young people and for the middle-aged people, the exercise and weight loss was just as effective as the medication. But when you started looking at the older adults, the only thing that was effective was exercise and weight loss. And in fact, when you looked at people 10 years later, the people who got the exercise and weight loss continued to have a lower risk for developing diabetes than the people who got the other sort of intervention. So one great example of the benefit of exercise. Still another study that's very impressive to me is a study that was supported by our institute that looked at whether or not exercise could truly prevent disability. When I was seeing patients on a daily basis, they'd frequently say, Dr. Bernard, I really am afraid of developing disability and becoming a burden for my family. Well, this study was asking that question, can you prevent that? And it took people who were 70 to 89 years of age, and they had some sort of baseline problem. They had trouble getting up from a chair, or they couldn't walk at a very fast pace. And they were either assigned to, again, a control group. In this case, they got education about healthy aging, or an intervention group, which consisted of exercise. It was moderate intensity endurance exercise, walking. It was strength training and was flexibility. And at the end of the study, it was found that the people who were on the exercise intervention were much less likely to become disabled than those who had the healthy aging intervention. 20% decrease. In other words, 1 out of 5 people who would otherwise have become disabled did not become disabled. So another example of some benefits of exercise. And we have lots of other research supported by NIH that's demonstrated that exercise can decrease the likelihood of breast cancer, colon cancer, heart disease. As I said, if there's anything that might be a fountain of youth, exercise may be it. So if we know that, do we know how much exercise? Well, the Department of Health and Human Services, in their recent physical activity guidelines, recommends 150 minutes per week of moderate physical activity, or 75 minutes per week of vigorous activity. What's that? So moderate activity is getting out and getting the heart rate going, etc. But while you're doing that, you can carry on a conversation. Whereas vigorous activity, you're out, you're really pushing hard, and you can only get in a few words before you need to stop and take a breath. Another component of the Department of Health and Human Services that puts out guidelines for public health, a group that does what's called the Healthy People Guidelines. They put out guidelines for every decade. They had Healthy People 2000, 2010, 2020. For the 2030 guidelines, they are recommending that all older adults be physically active, because it's recognized that there are some older adults who may truly be disabled or may have cognitive problems, who really aren't able to get to that goal of 150 minutes per week of moderate degree physical activity. But it's clear that being active is important to the aging process. Again, our institute has supported research that has demonstrated that even people who are 80 and 90 years old in a nursing home, if they're put into a program where they get physical activity and strength training, they're less likely to have falls and other complications. So bottom line, as an older adult, it's important to be physical, important to do as much as you can. If you can get to that 150 minutes per week, basically 30 minutes per day, 5 days per week, that's great. But you do what you can. And you should give yourself credit for what you do, like working out in the garden or cleaning the house or chasing after your grandchildren. They all count. So what types of activity should one have? There are basically 4 domains that our research has demonstrated are really important to the health of older adults. One is endurance training. That's that getting out and getting the heart rate up. People also call it aerobic exercise. Another component is strength training. A third component is balance training. And the last is flexibility. So let me elaborate on those. Endurance training is pretty evident, and it's something that you see some people going out jogging and climbing and biking, and for other people, just fast walking can get their heart rate up. Whatever works for you, whatever is best for your body. Strength training is really important because of the issue of changes in the muscles with aging. We hit our maximal muscle size and strength in our 30s and 40s, and then from there it's a progressive downhill course. And it's been found that for older adults, if you were to look in, cut across here and look at the muscle, we can do that with x-rays, you find that there's accumulation of fat in the muscle that makes it less strong and less resilient, kind of the way you see marbling in aged beef. Other research has demonstrated that you can lessen those effects by regular strength training. So that's the second component. And then there's balance training. There are changes that occur with aging that put one at greater risk for having problems with balance. And then on top of that, if you have chronic illnesses and medications, they may cause problems with balance. Balance problems often are a reason that older adults are afraid of exercising. But there are things that can be done in terms of training to help to offset that. In particular, Tai Chi has been demonstrated to be really helpful and helps decrease the likelihood of an older adult falling and having problems, hip fractures, etc. And finally, there's flexibility training, stretching. It's really important to do that to keep all the joints moving. Many an older adult has trouble looking for blind spots in the car. Exercises to keep that flexibility going is important. They have trouble reaching up to the top of the cabinet because they've lost flexibility in the joints there. Keeping all of the joints mobile is important and helps with issues, again, catching yourself when you're going to fall, that sort of thing. So those are the 4 domains that are important, and I will shortly demonstrate each of those. Before I do so, however, I just want to talk a little bit about safety. It's important, if you've not been exercising and you want to get started with an exercise regimen, to make sure to consult with your primary care provider to know that it's a safe thing for you to do, or whatever it is that you're planning to do. And then you need to have your water, whether you're inside or out. If you're planning to go out, you need to make sure that you have a safe route that you're going to pursue. If when you're exercising, you develop any problems with dizziness, chest pain or pressure, or heartburn, you need to get to the nearest healthcare facility to get that checked out. Those are danger signs. And when you're going out, you need to make sure you're layered so that if you get overheated, you can take things off. You need to, if you're going to do things like biking, have appropriate safety equipment, helmets, to take care of yourself. So prior to the pandemic, as I said, I've been exercising regularly since my 40s. I went to the gym. I took advantage of the elliptical, the stationary bicycle, the free weights. And I also went to a hot yoga studio. That helped with my balance and flexibility. I loved it. Neither of those have been available to me since the pandemic, so I've had to adapt. And I have rediscovered exercise to dance videos. It's been a lot of fun. Gotten some free weights after a lot of difficulty. They were really hard to get initially. And I'll talk a little bit about options if you don't have something like that available. And I've been doing my own yoga at home, walking in the neighborhood, things of that sort. So let me demonstrate some of the things. I'm going to step back. I don't know whether you'll be able to hear me as well, but I'll step back anyhow. And the first thing that you should always do before you get started in doing any vigorous exercise is to stretch, to make sure to avoid problems with injuring yourself. On the dance videos, it's just gentle movements such as this, and this, and this. From the yoga perspective, I love my asanas, and so I will do something like this. And there's something that we call triangle. I'm going to turn my side to you so you can see what I'm doing. Enjoy this. It's really good. And there are several minutes of that sort of thing to warm up the body. And then from the standpoint of endurance exercise, as I said, early on it was hard to get weights. So another option, cans. They, you can see what the weight is. If you're accustomed to using weights, this may be a little light, so you have to do more repetitions. If you're not, it's a great way to get started. I was finally able to get some low weights online, so I'm going to demonstrate a little bit of what my routine has been. If I can get my, of course this is locked out. Be patient with me, please. Okay, here we go. Okay, I could keep doing that for another 20 or 30 minutes because it's fun, but we only have so much time. The whole point is to do something that you find enjoyable, have a variety of activities, and do things to get your heart rate up. The fact that we have to do a lot of lifting the arms and legs and things like that, it's more likely to get the heart rate up. I will say that when I watch these dance exercise videos, the instructors are usually at least half my age, if not younger. They're doing a lot of jumping. I don't do that. I do what's good for my body, and that's what I would recommend for you as well. Then there is the issue of balance training. You need to make sure to have appropriate supports around. I would really encourage you to take a look at our website or at the National Institute on Aging YouTube channel because there are lots of examples of how to go about getting started with exercising, stretching, etc. The balance recommendation would be from some of the videos that you stand on one leg with a chair if needed, or that you try to walk in tandem like this. Again, as a yogi, I prefer tree pose. You'll see I'm not like the younger yogis with my foot on my thigh. I do what works for me. One can even have the foot down as low as the ankle. But the whole point is to work on your balance. So I think I've demonstrated to you all 4 domains. There is flexibility with the stretching. There is endurance with the aerobic. There is strength training with the weights. There is balance training. I would say that the most important thing is to simply be active, do what works for you, and keep striving to do more. So I really thank you for your time, and I wish for you safety, activity, and health.